Hello, my name is Dr. Chandni Nakum and this channel is dedicated to all things teeth and dentistry. I'm a dentist based in the UK and I enjoy making people smile, not only from the outside but also from within. I want all of you to understand your teeth better, so I'm trying to make more complex information into bite-sized, simple and an easy way to understand more about your teeth. Today we are talking about staining. Staining and the 4 biggest causes. Everyone worries about staining, it doesn't make your teeth look nice, and what can you do to improve that? If this sounds good to you, then please do subscribe and hit that thumbs up. If you have staining around your gum line and also between your teeth, then it's very likely that you have something called extrinsic staining. This is usually staining due to tea and coffee stains, red wine, curries, and then it accumulates onto the surface of your teeth. Usually you tend to brush away the staining, but if there are any areas which are hard to get to, then it builds up as staining. And this is what we call extrinsic staining because it only builds up on the superficial layer of the tooth. If you're worried about this kind of staining, don't worry too much because this is actually the type of staining which is a lot easier to deal with and to get rid of. Cause 1, food and drink. So like I mentioned before, tea, coffee, red wine, curries, anything which contains a lot of colour will generally stain the surface of your tooth. Like I said, this is extrinsic staining, so it only stains the outer surface of the tooth, but this is usually the #1 cause for staining as it accumulates over a period of time. Usually it looks yellow or brown or darker in colour as well. Cause #2, smoking. As everyone usually knows, smoking tends to lead to staining, especially on the surface of your teeth. The more you smoke, the more obvious the stains are usually going to be, and they tend to be, again, a yellow-brown in colour and can also get a lot darker depending on how often this staining is removed. Smoking stains can be a little bit more stubborn to try and get rid of, but there are ways around this. Usually I would recommend going to see a hygienist so you can get a really deep, thorough clean, and this is usually quite helpful at removing the staining. What is the cure for extrinsic stains? So like I mentioned, extrinsic staining is the stains that build up on the superficial outer layer of the tooth. So the easiest way to get rid of that is usually by a deep, thorough clean, and that can be done by your hygienist or by your dentist. Another step up from that, if it's not quite getting rid of all of the staining, is also to undergo a whitening course. So whitening is when you whiten the surface of your teeth in order to, again, mask the staining. If you are interested in whitening, then please be sure to check out my whitening video that I'll also link in the description box below for you. Another way of making sure that these stains don't accumulate is also to make sure that you're brushing regularly at home. Brushing and flossing will really help to stop the staining from accumulating, which means that it doesn't become as stubborn and it's a lot easier for the hygienist, dentist to be able to remove. And also the most obvious way to stop the staining from building up is to stop eating a certain food and drink which causes your teeth to stain, and also to stop smoking. Okay, so we've just spoken about extrinsic staining. The other type of staining is intrinsic staining. So that means that the tooth itself is discoloured from the inside. It's internally discoloured by certain chemicals, and this can happen due to a number of reasons. Cause #1 of intrinsic staining is tetracycline antibiotics. Often this is prescribed for quite bad acne, and due to this medication in the past, it can give rise to a banding effect that runs through the teeth, and also can give it a bit of a strange colour, which can sometimes appear red-brown, and this can be a reason for why the intrinsic staining has appeared and why the colour of your teeth are the colour that they are. Cause number 2 of intrinsic staining is fluorosis. Fluorosis appears due to too much fluoride being taken into the body, and this can happen through lots of different things. So for example, toothpaste as a child, you may have unfortunately eaten it instead of spitting it back out. Fluoride is also available in salt, and also some areas of the UK have fluoridated water. So there is actually fluoride placed in drinking water, which also means that you might be intaking a tiny bit too much fluoride. All of that gives rise to something called fluorosis. If you want to know more about fluoride, then I did a whole video just about fluoride, its effects, its side effects, pros and cons, so please make sure to check out that video because I think it would be quite useful to watch. So what are the cures for intrinsic staining? As you can imagine, this is quite difficult because intrinsic staining depends on what caused the staining in the first place. And often, because it's internally present in the tooth, it's a lot harder to mask because it means that things like whitening might always not be very effective. It's important, if you were looking into potentially getting rid of these stains, that you speak to your dentist first so that they can give you the best option possible. The reason why speaking to your dentist is so important is because you want to have the minimally invasive treatment options first before going to more invasive options. So for example, lots of people talk about veneers and say that they want lots of veneers to be able to mask it. However, that doesn't mean that something like whitening might not be suitable first, or potentially fillings, because it means that we're removing less of your natural tooth, which is better to ensure that your tooth lasts for as long as possible. I hope you found this video on staining and potential cures useful. If you found this video helpful, then please do click the subscribe button, hit the thumbs up, and also hit that bell notification so you don't miss any of my videos.